Well, good afternoon, and thank you for choosing our session. My name is Karina Quezada, and my co-presenter, Dr. Bonnie Garcia. Both of us work for the Desert Mountain SELPA office up in the high desert in Apple Valley. And we function as program specialists with different specialties. I tend to do work related to meaningful parent participation kinds of things and alternative dispute resolution issues, and also a little bit of the school psychology pieces, as well as dyslexia.
And I also do some work around dyslexia, universal design for learning, as was kind of talked about at the last keynote session, and other types of universal academic supports. And I come from a background of, I was an RSP high school teacher for years, and before that, in an alternative ed and an ED class, so I have some teaching experience.
All right. Okay, great. So you selected the session regarding dyslexia, and our goal today is to provide an overview of what dyslexia is as it relates to the school setting. As a disclaimer, in no way will this provide you with all the comprehensive knowledge that you should know about that. However, if you choose to learn more about it at our regional trainings, which are provided in the high desert, we offer that twice a year, and you're welcome to come out. This is actually a 2-day training for us, condensed to 45 minutes for you this afternoon. Yay. But we will be offering that in the fall and also in the spring. Look us up on our email address. Before we get started, I want to invite you to review this later on at your leisure. We have placed a lot of the resources that you're going to hear us talk about today in a Padlet for you to access. So this is the address. You also have a handout with that information, and it's on the board in case you would like to refer to that later on. All right? Okay, so what is dyslexia? We'll go ahead and start with that. And this is the one portion that I will read because it's lengthy and I haven't memorized it yet. But it comes from the International Dyslexia Association. And in 2002, from all around the world, these minds gather, and they came up with a definition that is now recognized throughout the world. And dyslexia is a specific learning disability that is neurobiological in origin. It is characterized by difficulties with accurate and/or fluent word recognition and by poor spelling and decoding abilities. These difficulties typically result from a deficit in the phonological component of language that is often unexpected in relationship to other cognitive abilities and the provision of effective classroom instruction. Secondary consequences may include problems in reading comprehension and reduced reading experience that impede growth of vocabulary and background knowledge. They have a wonderful illustration of that definition for us so that we can capture that concept hopefully a little easier. So basically, dyslexia presents as a deficit in the phonological component that affects decoding, spelling, accuracy, and fluency, which in turn affects comprehension, reading, and experience. And when you're not being very successful with your reading experience, then your vocabulary, background knowledge suffers, and as a result, your comprehension also suffers, right? So it's a chain reaction that repeats itself, a vicious cycle. So how prevalent is this? In California, it's estimated that about 1 million children suffer from some form of dyslexia. And interestingly enough as well, about 80% of all special education students who are currently identified have some kind of a reading-based kind of disorder. So the majority of our students who are in special education present with a reading deficit. Okay. And it's also believed that about 40% of the population in the US suffers from a form of dyslexia. So it's very much an issue for us in special education, in general education as well. Okay. Therefore, California, along with many other states, have now joined in creating guidelines to help support school districts and educators in the identification and screening of dyslexia. The guidelines were released in August of this past year and were revised in October. And they are available from this website. They're also uploaded into the Padlet, and you can just access that really quickly. It has a wealth of information in regards to interventions and effective practices for teachers. So what are the symptoms and characteristics that we can anticipate with a child who has dyslexia? Typically, we see children who are unable to rhyme. They have difficulty hearing and producing rhymes themselves. They have difficulty learning letter names and the alphabet. They tend to have a confusion about certain letters that look similar, like P and Q, like B and D. Okay. They also have a confusion with sounds that are similar, such as f and v. Okay. And they tend to either do reversals or transpositions that are past the age of 7. You know, in younger children, that's not abnormal. But if you're looking at those behaviors later on in the school-age years, then you might be looking at a sign of dyslexia. Other problems can be related to having irregular words that are not spelled correctly, such as once. So those words that do not follow the rules are very difficult for children who have dyslexia. They also have difficulties with spelling. For instance, the word once in a paragraph, they might become very inventive in their attempt to spell that word, and you see it spelled different ways. They also have difficulties pronouncing multisyllabic words, and just a slow perception of reading, and therefore fluency and pace is very laborious. We see in children who are dyslexic, they have typical IQ levels, so their intelligence is intact, and they have strengths in areas that are not heavily impacted with reading, such as in math and science. But with Common Core and everything that has been going on in the last few years, we know that math and science now require a heavy load of reading. So that's not necessarily the case anymore. In regards to intelligence, keep also in mind that children with gifted intelligence can also be dyslexic. So those two can coexist. Therefore, in many occasions, children are not identified until later on, when the subjects become just so much more difficult, and sometimes not even until graduate school. Okay. So what dyslexia is not, let's talk about what is not. It is not a pervasive oral language impairment. So it becomes critical to involve your speech and language pathologist when we're working with children that we suspect have dyslexia, because we want to rule out those pieces. Is not a primary factor related to behavior or attention, is not a problem dealing specifically with reading comprehension. That is not dyslexia. So if the child is able to read and decode and it's fluent, but they lack comprehension, you're looking at a different issue, not dyslexia. Is not related to poor vision or hearing, is not an emotional or behavioral problem, it's not autism, it's not schizophrenia, and it's not related to limited intelligence. It's also not related to ethnical or income issues, and it should not be the result of poor teaching practices. Right. Other myths related to dyslexia. People tend to have the misconception that if you have dyslexia, that means that you read backwards or that you write backwards. And that's not necessarily the case. Also, there's a misconception in many of our school staff that dyslexia is not really understood, therefore we shouldn't be touching it, we shouldn't be talking about it. And then there's also those that believe in our school setting that dyslexia is a medical diagnosis that needs to be handled outside of the school, and it's diagnosed by a neurologist. So therefore, we don't talk about that in the school setting. And with that also comes usually the misconception that it's not identified until after the age of 3, in 3rd grade. And that individuals with dyslexia just have a low level of IQ. So those are all misconceptions. And it's really one of those primary reasons why those community grassroots movement came about, and the push in our government to create guidelines so that these things are not happening anymore. Up in Northern California, Berkeley Unified School District has found themselves up in the federal courts because their practices were exactly that. Their practices were dyslexia is a neurological disorder. It needs to be handled by doctors. Parent, you think your child has dyslexia, go find solutions somewhere else. It does not belong in the school district. Okay. So, all right. So in regards to dyslexia in the brain, again, we only have a few minutes. So I'm not going to get into all of this, but it is just really briefly what I'm going to say is that when we are engaged in the act of reading, there are several portions of our brain that are involved, and they're all working in conjunction. But the primary factors that you will see associated with reading are having to do with the temporal lobe, where your auditory processing is housed, along with the occipital lobe, where the visual cortex is housed. And then the parietal lobe is what actually generates the communication with this two, where you are seeing the word and making meaning out of it, and there's a production of that understanding of that word. So all of that is very complex. I don't have time to explain any of that, but what I do want you to know today is that this is the typical functioning of the way in which reading is engaged. A lot of the activity that is happening in our brains is happening in the back, in the parietal temporal, and in the occipital. In children who are dyslexic, however, what studies have concluded is that the majority of their activity is happening in the frontal lobe, where they're trying to access memory parts. Okay, so they're trying desperately to memorize words as opposed to engaging in the act of sounding out and making meaning of the sounds with the representation of the visual component of language. So all of that activity in the brain is absent, and their main focus is trying to engage a compensatory part of your brain where memory has been triggered, and that becomes very ineffective and frustrating for kiddos. So that's it for the brain piece because of time. But another important thing to remember today is that dyslexia presents in a continuum. Okay, you may have, or you may also be yourself an individual who has some reading difficulties, but you have been able to manage due to other strategies that you've learned along the way. But that's not necessarily true for many children. Many children require services and special instruction in order to overcome those deficits. So it can present in a range, just like other conditions are, such as autism, if you can relate that. Okay. So when we're dealing with children and identifying whether we're dealing with dyslexia or not, we have to keep in mind and understand and try to determine what the reason behind the underachievement in reading is. Is it due to lack of appropriate reading instruction, or is it due to a disorder or a disability that actually exists? And as school officials, we are mandated to determine that. That is our specialty. It belongs to us to know that, okay? Why do we need to do that? And we need to do that early on is because we know that early intervention is critical. Studies have concluded that as early as age 4 and even sometimes at age 3, we can begin to see some of the signs of dyslexia in our little toddlers, okay? So there isn't that magical third grade waiting period that needs to occur. We know and we can identify practices from very early on that will tell us if a child has the propensity to develop dyslexia. And it's never too late to remediate a child either. So even if you are not identifying the individual until later on, we can still do something about it. We also know from studies that the brain can rewire after 80 hours of intensive instruction. Okay. So this is a study, a famous study that was conducted by Simons and other individuals. who have determined through MRIs that after providing that intense intervention, children who are not showing any kind of activity in the areas that I pointed out before, after receiving interventions, their brain activity changes drastically. Okay, so we have that proof.
So what do we need to know once you've identified the students and there's, you know, and you've decided that the student needs some intervention? What does that consist of? What does reading instruction consist of? Well, according to Ed Code, starting with that, students with dyslexia are supposed to have instruction that is evidence-based, so backed by science, that it's multisensory, so it's using multiple senses in order to meet the different learning needs of the students, that it's also direct and explicit so that they know exactly what they're doing, why they're doing it, and that it's structured and sequential, so that it's following the flow of the English language. And don't have the little clicker. And if we were to define intensive, there are a few things to consider: frequency, duration, as well as student to teacher ratio. So frequency being daily, duration anywhere from 45 to 90 minutes, and adult to pupil ratio is typically pretty small. And daily, because we know as teachers that after students are presented with content or new learning, it's very easy to forget the very next day. So the more practice, the better it is that they're going to be able to retain that knowledge. So a few things to consider. Two of them are, the first is the 5 components of language, and the second are the 5 critical components of reading. And what that is, for the 5 components of language, is phonology. And then, so that's basically the sound, symbol associations, recognizing letters. Morphology, so knowing like the different parts of words and how they create meaning. Syntax is putting all of those words into a sentence. Semantics, making meaning of that. And then pragmatics, how they use that language socially. We usually see students with, who have autism struggle with pragmatics because they aren't able to understand the social cues and therefore aren't able to really understand what the person who's speaking to them is trying to say. So that's what that pragmatics is. The 5 components of effective teaching instruction in sequence are phonemic awareness, phonics, fluency, vocabulary, and comprehension. And Karina, I know that you've identified these 3 because those are specifically the ones. Trade off.
So we know that these 3 are the ones that are highly associated with dyslexia. So if you have children that are struggling with these 3 skills, the likelihood of dealing with a child who's dyslexic is very high. This one's not so much. This could be related to limited exposure or other issues, but not to dyslexia necessarily.
So then when we talk about usually some of the evidence-based programs, usually we're focusing on these specific areas, although the programs also focus on this. But when we're talking about developing the first parts of language, we would look at the phonemic awareness, phonics, and so forth.
So I've kind of discussed with you what dyslexia is. Now there are 3 types that we're going to do a quick, dirty overview as well, okay? So there are 3 types, and one of them is called phonological dyslexia, sometimes referred to as auditory or phonetic in certain literature. The other one is called surface dyslexia, sometimes referred to as visual, and then there's deep dyslexia. When you have a child who's dealing with phonological dyslexia, what you're going to see is a child who has difficulty rhyming, who has difficulty hearing the sounds within words. They may have some receptive language deficits as well, and they just don't know how to attack a basic word. So the word cat, attaching those simple sounds to those letter manifestations is very difficult for them. They usually also, most of the time, have difficulties with nonsense words. So reading a word that you made up and trying to sound that out is not something that they can access. So they tend to rely on other compensatory processes. Those are the kiddos that when you're listening to them read, they'll just throw in whatever word and they're waiting for your approval to see if that's the correct yes or not. Okay.
One of the other parts of reading instruction that I didn't mention that's not up here, it's structured literacy, and that was in 2016 identified as an effective reading approach by the International Dyslexia Association. So it basically has all of those components. It starts off, I believe, with phonological awareness, phonics, and then, or sound symbol association. So it goes up the ladder, and that's basically the structure of the language and how it's supposed to be taught. For phonological dyslexia, these are some evidence-based programs. It's a non-exhaustive list that you could use specifically to address this type of dyslexia. It was Dr. Stephen Pfeiffer who recently presented at NASP. He's an adjunct professor of neuropsychology for George Washington University, a school psych and a licensed psych. And what he recommended, this is a remediation basically guide that he provided, and he said that if you have students under the age of 7, you're gonna use a bottom-up approach, mostly focusing on phonological awareness and then phonics. If you have older kiddos, you're gonna use more of a top-down approach, which is more of a morphological approach. And that's mostly because around the age of 10 and 12, auditory pruning begins, and then it becomes more difficult to gain those skills. So rather than exhausting ourselves there, using a more effective approach such as the top-down for students a little bit older. Here are some strategies for phonological dyslexia. You can use them in isolation, or you can use them together. So for example, the word top, one way to teach phonological awareness could be through arm tapping, and that's just to teach how to break down the sounds. So if I was to say the word top, I would sound it out top, right? So, and the way to integrate multisensory instruction, I could easily also just write it up. So I could have the word top. Oh, this doesn't work, but if it did. So using way better markers, you would have that visual component, and then you'll also have a tactile and a kinesthetic component as well. So if I were to tap out the word top, I would go top. So sounding out every letter and then going over my entire arm to signify that that's the end of the word. So if you guys can stick out your arm for me, I'm going to choose a word for us. Let's see, the word hot. Right? So let's sound that out. Right? Now let's tap it out. Hot. All right. So that's one way to integrate multisensory instruction into with reading. Another thing to do is another activity, and I actually learned these activities from this organization, Kendor Learning, who provide professional developments for integrating curriculum systematically, structurally, using all of those keywords. And this is one activity that I learned from them. It's a beach ball toss. And we can use this, again, to develop phonological awareness. And what I'm going to do is I'm going to toss the ball out right now. And wherever your hand lands, you can choose a thumb, any thumb, select that picture. So I might say sun is where my left thumb landed. What word rhymes with sun? Run. Now I'm going to have to use both of them in a sentence. The sun runs. So now I'm developing that phonological awareness through rhyming, and I'm also putting it in context by putting it in a sentence, okay? Let's try this a couple times. So I'm going to throw it out. So choose a thumb, any thumb, choose a picture, say the picture name, okay? So what is it?
Snake.
What word rhymes with snake?
Bake.
Good. Use both of those words in a sentence.
I baked the snake.
Good. All right, toss it to another person. All right. Any picture? Block. Okay. What word rhymes with block? Clock. Okay. We use those words in a sentence.
I should not block the clock.
Good. No, we all want to get out of here on time. Toss it to one more person.
Oh, there you go. It's a bee. Rhyming word would be me. So the bee stung me.
Good. You can toss that back to me. Oh. So those are just some activities that you could use to help students with phonological dyslexia. And let me see if there's another one for me. No, this is back to Karina.
All right. So the next type of dyslexia is surface dyslexia, and you're going to see children who have no difficulties sounding out words that are phonetically happy, okay? So as long as they follow the rules, we're good to go. So the word grand, not a problem. But anything that is not following the rules, we don't know what to do with it, okay? So for instance, the word right, you might have a kiddo who will try rig, hut, and that's good, and for them, they're good to go. You're also going to see spelling irregularities, such as the word they. They want to make it fit what they know, which is to make it phonetically coherent. Okay. Yeah. Yep.
Again, a non-exhaustive list of evidence-based programs, and this is what Dr. Pfeiffer recommended as far as the remediation guide, top-down, bottom-up approach. So for surface dyslexia, here's again a few strategies that you could use. I am going to demonstrate one that I again learned from Kendor Learning, and what I'm using is what they call cops and criminal cards. So basically cop cards are words that are spelled phonetically correct, and then criminal cards are those that are not spelled phonetically. So they're non-phonetic words. Who here has been to an arcade and you have the little whacker where you're like hitting the head? Okay, so we're gonna play word whacker. I need 2 volunteers. So I kind of pre-selected. All right. Okay, so if I can get you guys, thank you. And this can be pretty cheap. Okay. Use a fly swatter, whatever you want. These are your wands. Your wands have to stay by your side. So we have sight words, and this is to develop those sight words. And you have, again, the phonetic and non-phonetic words, okay? So it adds a little bit of competition. What I'm gonna do is I'm gonna say the name of a word. We're only gonna do this 3 times. I'm gonna say the name of a word, and whoever hits that word first is going to be the winner of that card. Whoever didn't hit that word, you're going to say that word, and you're gonna try to use it in a sentence, okay? So let's go with, let me see, C. Yeah. Okay, so C. Use the word see in a sentence, Natalie.
I see the camera.
Good. Okay, so one for her. Let's do 2 more. Let's say 8. You're being nicer. Okay, so 8. What's one word that you can use, or one sentence you can use the word 8 in? There we go. Now for the tiebreaker, the moment we've all been waiting for. Okay, so how about the word help? There we go, good. Okay, so now can you use the word help in a sentence?
I needed help finding the word.
Good. Give them a round of applause. So it's an easy way to build engagement. It helps them build sight words. If you were to have them spell out that word in the air and then use it in a sentence, you're again integrating that multisensory reading approach. So it's just another fun game that you could use.
In regards to deep dyslexia, this is a severe form of dyslexia in which other deficits are occurring at the same time. Usually children are showing semantic errors, such as they'll replace a word without any meaning into the sentence, such as gate is read as fence. Or I'm sorry, that does fit, but they make it fit. Visual errors, such as house for horse, or they'll make derivational errors, such as mountain read as mountainous, or difficulties reading words such as the, a, or so. So the typical words that are considered easy by the rest of us are very difficult for them. Usually, this type of dyslexia is associated with some kind of a brain insult, resulting either from a stroke or a traumatic brain injury. And the approach for this is?
You basically use those approaches together as you would use for the surface and the phonetic dyslexia. Another thing to definitely consider is the multisensory approach with some fluency practice, Orton-Gillingham. Has anybody heard of the Orton-Gillingham? Okay, so using the Orton-Gillingham approach is one way that is one approach to reading that is highly recommended. And what that is, it's a multisensory approach focusing on three more modalities of learning: visual, kinesthetic, and tactile. And it's also flexible, it's structured, it's sequential, it's cognitive. So that's one that's very expensive to get or to be trained on. But some of the programs, evidence-based programs, if you look into them, will have some component of OG implemented in it. So that's one thing to consider as you're researching which programs to use for your schools. And then just an array of strategies that you can use, including the ones that we kind of just went over. So we only have a few minutes. I'm not going to go too much into that. And then here's, if you want to look up these programs, you can use this Google link here, and you can click on it. It'll give you some information. Make sure to pay attention to how OG-based it is, what great age groups it's working for, what it's focused on. Also, how it's presented. Is it all face-to-face? Is it blended? Is it all online? Do you have the resources for it? Meaning, do you have the money, the staff, the expertise? So all of those considerations.
I think I only have a few minutes to cover this section, but we talked about what it is, we talked about the different types, we talked as we were going, what to do about it, what interventions, what reading programs to utilize. The International Dyslexia Association has a position paper that recognizes that even though you might be identified as dyslexic, that does not necessarily mean that you require an IEP. So let's keep that in mind, let's keep things focused. We have to, within the general education setting, exhaust all of our resources before labeling a child dyslexic or before determining that that child requires special education services. So in order to be to do justice to children and to serve them well, there are certain components that we should be integrating in a school setting. And those are related to how we do evaluations. And we believe that evaluations and screenings for dyslexia start at the formative and summative assessment level, where teachers are engaged in formal assessments of children and also in the formative assessment, meaning that as you are teaching, you are determining the appropriateness of your instruction and the appropriateness of what is occurring in your classroom. And then after that level of assessment comes the screening assessment. So you've identified maybe a percentage of your class that is requiring something else besides what you're providing to everybody else. That becomes your screening process. And remember, early intervention is appropriate. We should be screening our pre-K kiddos, okay? After that will come further reading assessments. So for those children that you have identified at risk, what else are you going to do about them? Well, further assessments in reading should be done. And then after that would come maybe a referral to special education, with other components of cognitive processing are being analyzed by a school psychologist or a speech pathologist. Usually processing speed, working memory, and attention are related and coexist with dyslexia. And of course, at this level of referral, we're also looking at an in-depth kind of assessment of academics. Okay, so a screening, the difference between a screening and an evaluation. A screening should be a quick and easy way to determine what kiddos are at risk for developing dyslexia. At this point, we are not diagnosing. We're just saying, hey, there are certain things, certain markers that you're demonstrating that could potentially mean that you're going to develop something. So the purpose of that, of course, is to tailor our instruction, right? So that we're intervening, we're remediating, we're providing phonemic awareness instruction to you, because that seems to be an area that you're having difficulty with, okay? So what are those areas that should be part of a dyslexia screening? Letter naming, letter sounds, rapid naming, phonological processing, phonemic awareness activities, word reading when we're talking from K to first grade, and nonsense words, and this is recommended for first grade and beyond. Children who are younger than first grade don't have that capacity yet. And then oral reading, if you're dealing with a child who is first grade and above. Now, I noted with little stars here, the 3 areas that are highly correlated with dyslexia. If you are demonstrating the rapid naming kinds of difficulties or phonological processing difficulties and nonsense word reading difficulties, more than likely, you might have the tendency to develop dyslexia later on. So those 3 should be critical pieces to assess or for screening purposes. And then, of course, when we're talking about an evaluation, it needs to be comprehensive, that you're involving other individuals who have expertise in that area, your school psychologist, your reading specialist, if you're fortunate enough to have one in your district. And usually speech pathologists are also involved in that evaluation. And at this point, we're also being very conscientious that we're eliminating other factors that could be going on, such as poor instruction or lack of the evidence-based programs that we've identified throughout this afternoon. Okay. Other areas that are usually analyzed when we're doing a comprehensive evaluation have to do with the things that we discussed, but also memory span, working memories, which is what you want to involve your school psychologist in that process. All right.
So 2 kinds of assessments that as educators we're familiar with, and it's same with reading, is using both formative and summative assessments. So formative, those low stakes intermittent assessments to see, check students' progress. Summative are those big ones, those big tests at the end, or those might be your universal screeners that you might conduct 2 to 3 times a year. Here are some examples of both. Something to consider when you are doing such activities. If you have an aide in the class, it could help you with some charting and writing down some observations. So if you notice that there's students who are struggling with rhyming or struggling with some of these activities, then you can go ahead and chart those, and that can be your data in order to determine if there's extra support or interventions that are needed. So the emotional impact of reading, Dr. Quezada talked about the reading experience at the very end and how that was involved in the definition. So that's a huge component in with students who struggle with reading. Somebody who has a reading disability, that actually increases their risk for academic, emotional, and behavioral struggles. Who has seen a kid go to the restroom when it's time for reading, or all of a sudden their stomach hurts, or maybe they start messing around in class because they know it's reading time and that's going to get them out of it. So understanding that those are the manifestations of them not being able to read well. Also, learning to read is directly related to how they feel about themselves, and it comes about externally and internally. So I'm going to show you 7 things that students with dyslexia want you to know. Take a second to look at them. Choose one that kind of resonates with you, and talk to an elbow partner, somebody next to you, about which one does and why. So for about 30, let's do 30 seconds. So we're getting into the end, so I'm not going to make you talk. But if you guys can, maybe somebody could share which one resonates with them and why. Yeah, because it's having a reading disability isn't correlated with intelligence, so I am capable, right? Well, this is, there was an article written by this lady, Angela Shaw. She's actually a teacher, and her husband has dyslexia. And I think this came about from some of her research as well as her talks with her husband, and just keeping in mind, like, they have these strengths, and then it doesn't just affect them at school. It can affect them when they go try to order something from the fast food menu and aren't able to order it. So just understanding how much it can affect them and the emotional impact, and that we have the capacity to make a difference so they don't have to experience it that way. So again, reading is a work of art, and it's going to take all of us to help out those students with a reading disability. And we want to, perfect. Thank you for coming and for having us. Here's our contact information.
Here's our contact information, and we built in actually 5 minutes for questions if you happen to have any, but if you're eager to get out, I understand. Is there anything that we could answer for you?
I'm actually trying to mentor
I don't know, are you still recording?
an adult who has a learning disability, and for her to comprehend what it is that she's reading, and she's really hungry for learning, but she struggles. So her being older, like how can I make it fun for her, like, because she's not a child, but she wants to learn. Right.
So I'm glad you brought that up, and I think that's the top-down approach that Dr. Garcia was referring to in a couple of slides back. If you can go back to that, Bonnie. That is the intention of this approach, the top-down, because at this level, utilizing these programs and this approach, you are dealing with more of the background knowledge, the building of vocabulary, the building of comprehension as you are teaching some of the other isolated skills. But the focus, of course, with an adult would not be to develop phonemic awareness. That brain pruning has already occurred and is long gone. So the approach needs to be different. And I would encourage you to consider those programs and looking into them and seeing if that could be something that could serve a purpose for this. Okay. Any other questions? Thank you so much. We appreciate the opportunity to be here. Thank you.